Well, to Newfoundland and Labrador now, as the province has been hit by a major IT outage. It is hitting the healthcare system in Newfoundland and Labrador. It is also forcing the cancellation of many appointments, including some cancer treatments. Now, health officials are reluctant to say too much about the possible cause of all this trouble, but it appears the province was hacked.
We may have been victims of a possible cyber attack by a third party. This led to progressive failure of what's been described to me as the brain of the data center and a loss of functionality in systems across the regional health authorities. Because of this, we activated our Provincial Emergency Operations Centre to more fully address the impacts across the system, whilst at the same time ensuring that Bell, Centre for Health Information, and the appropriate authorities were notified to look into the background to these failures.
Our Chris O'Neill-Yates is covering the story in St. John's for us, and she has more now on the impact this attack is having and the reaction.
This is an extraordinary situation affecting the healthcare system all across Newfoundland and Labrador today. Health Minister John Haggie was very cautious in his language, saying that they suspected it's a cyber attack, but sources are telling CBC it's a ransomware attack, although the minister didn't have any information on that or whether a ransom had been demanded. But what we do know is that the Eastern Health Board Authority, which represents the largest population in the province. This here is the largest hospital in the province, the Health Sciences Centre. If you're not going to emergency today, if you've got a surgery or an appointment to see a specialist or most any other kind of appointment, you won't be getting seen here today. It's emergency services only. The other 3 health boards across the province have been affected, but not to the same extent that Eastern Health has. The Minister of Health called this an attack on the brain center of the healthcare system, which is maintained and supported by Bell Alliant. We also heard today from the CEO of Eastern Health, David Diamond. He told us what services are affected by this IT outage. Here's a bit of what he had to say.
Pretty much all of our systems at Eastern Health at the moment are not functional as a result of this particular outage. And that includes everything from registration. We can't register people electronically. Our email systems are down. Our patient information system is down. We're not able to access diagnostic imaging or lab results electronically. And so we have gone into contingency mode.
So throughout most of the system today, it will only be emergency services and the use of pen and paper, since computers and reaching people through email is not possible since the whole email system is down. So they've got a toll-free number that people can call, and they're basically just trying to reach out the old-fashioned way and tell people that their appointments have been rescheduled or canceled altogether. The minister talked today about days, possibly days, before we know what happened here. The investigation is continuing, and he says that when there is more information about what's happened here, that they would make that known to the public. Chris O'Neill-Yates, CBC News, St. John's.